Hello, and welcome to another episode of Improve Healthcare, the show that focuses on ideas and insights to improve healthcare delivery continuum around processes, policies, and patients. I'm your host, Rich Greenhill. Today, we will discuss healthcare delivery and trends with our highly sought after special guest, Dr. Dan Gentry. Dr. Gentry is the President and Chief Executive Officer of the Association of University Programs in Health Administration. AUPHA is a global network of colleges, universities, faculty, individuals, and organizations dedicated to the improvement of health and healthcare delivery through excellence in healthcare management and policy education. Dr. Gentry's career spans more than 2 decades, including roles as professor, program director of graduate programs, and associate dean. So without further delay, welcome, Dan.
Thanks, Rich. I appreciate being here. Thank you so much.
It's good to have you, Dan. So would you tell us a little bit more about AUPHA and some of the great initiatives that I hear you're leading over there?
Absolutely. Thank you, Rich. So I came on board at AUPHA last March after being an academic for 26 years. And this is a dream job for me. It's a role that only comes open every 12 to 15 years. I think since the organization was founded in 1947, I'm only the 6th president and CEO. And now I get I told folks when I was leaving the University of Iowa in 2019, preparing to leave, that after focusing on one program at a time or one school at a time, I wanted to find a way to work with more than one program at a time. And now I've got 300 universities to work with and several thousand faculty. We've got a lot going on. I came in at exactly the right time. The board was about halfway finished with a new strategic planning process for 2023, a 3-year period, and everything that we're doing is supposed to be implemented by then. So there are 11 initiatives across programs, individuals, and being the leader for health administration education globally, like you described in our mission statement. And then there are 4 major initiatives coming out of that I'd be happy to talk to you about as well.
Yeah, we'd love to get to that. I mean, I think that obviously I do some volunteering with it, full disclosure here. So, but it's just really awesome things that you're really moving us forward as healthcare, executives and educators. So, well, first, and maybe if you don't mind intertwining some of those things you're working on with this sort of first thought of giving us what, your take on where healthcare delivery is today and what you think the issues are from your vantage point, having all this experience and background.
Right. Yeah, absolutely. So one of the 4 major initiatives is directly related to this question, and it's under the role of being the leader, the AUPHA being the leader in healthcare management education. As someone who was responsible for 4 different graduate programs over a couple of decades, you're always having to scan the environment and think about what's happening with regard to the healthcare industry, and then what's happening in terms of healthcare delivery and healthcare management as you're preparing to train and educate students to go out and take roles among the employers. And then likewise, I mean, we always have to pay attention to what's happening in higher education as well. We've got so many challenges. I mean, you only have to look at the last year during the pandemic to know that's the case. And for example, how costly higher education is at this point. To some extent, it's like healthcare. We've built something we can't afford, and we're going to need to figure out a better way to deliver it. So AUPHA will be launching a new trends report. That'll be a biannual report coming out every other year. The first of these should be produced late this year in 2021 or very early in 2022. And it will lay out, this sort of state of where healthcare delivery is and where healthcare management education and higher education is. I think that as I was leaving Iowa, we were always trying to think about what's happening. What are the hottest things happening in healthcare? What should we be paying most attention to? And I think unlike some industries where, we have disruptive change, we haven't really seen disruptive change in healthcare. A lot of folks thought that when Chase and Berkshire Hathaway and those got together and they went out and they were going to do their own thing in healthcare, everybody's like, oh, there's going to be disruption. And it didn't happen. And in fact, just last year, they announced they were coming back apart. They'd learned a lot of lessons, but they didn't actually take any actions. They didn't do anything. So it's healthcare, because of how mammoth it is. It's one of the biggest sectors in our economy. It's something that people are absolutely dependent on. We've been building lots of bricks and mortar since the 1940s and 1950s. It's not like turning a tugboat. I mean, it's like turning the biggest ship that you can imagine. But I do think there's some things that we pay attention to, and they move slowly. So, for example, those 4 years I was at Iowa, the things top of mind, in addition to the things we were already covering, were a greater emphasis on data and evidence, clearly more need for analytics, and people who know how to not only know how to do that, but know how to interpret, and then cascade that into problem solving and decision making. A bigger and bigger emphasis on population health and population health management, and I think tied to the need to move away from episode-based, cost-based, procedure-based reimbursement, and more toward something that looks more like value-based reimbursement. So I do think there are things front and center. I just don't think they change every year. Like those 3 or 4 things we've been thinking about now for half a dozen years, not just the last year.
That's great, Dan. Great thoughts. A lot there. As you think about how complex it is, I wonder, do you think that, I'm new to academia as a professor, of course, but not new to practice. But do you think that the complexity of how healthcare runs makes it difficult to train students to think critically? If you have all these disparate parts working together in kind of this amalgam, do you think that complicates training students or getting them to think critically about how to improve healthcare, or do you, or not maybe?
I think that in the classroom, it's not as difficult. But I mean, we all know that the most powerful learning is done on the ground. I mean, it's when you actually apply. And I think when it comes time to apply what you've learned, it's not nearly as easy, because healthcare organizations are busy and they're understaffed. There's a lot of inefficiency. They don't adapt. They're not that nimble. And so students, or even more innovative entrepreneurial thinking folks, may join a more established, more traditional kind of healthcare organization and feel like a square peg in a round hole with regard to, why aren't we thinking more about innovation? Well, we're just trying to make sure all the trains run on time. We had an academic medical center like I was at the University of Iowa. It's, oh my gosh, we're at 97% occupancy. And we have no beds. Where are we going to put people today? Versus a lot of the other community hospitals, community-based or hospitals, nonprofits that are struggling just to get to 50% occupancy in the days prior to COVID, of course. So you've got very different kinds of organizations, and you've got, I think it's rare to have the kind of organization that can both steadily move forward, deliver good individual, family, community care like you need to deliver, stay abreast of everything that you're having to stay abreast of. For example, revenue cycle, making sure you're getting paid for what you need to do, because no one's going to pay us any more than they're already paying us for what we do. It's hard to do that at the same time you're thinking, how do we innovate? Now, right. I do think there's some really good exceptions to that. I mean, some of the sort of name brand organizations, I know Stanford has a new innovation center that they launched several years ago. I know a student who just took a role there with regard to administrative fellowship. And then I think probably the best example of an organization that began thinking about this 30 years ago is UPMC, where, they spun off numbers of organizations that are now recognized for being more innovative with regard to population health, value-based care, analytics. In fact, they've got businesses that, are taken together to approach their reimbursement with regard to, or their revenues with regard to some of their direct service lines. I mean, that's how well they've done. And now they're able to offer those services, those specialized services, to healthcare organizations outside the Pennsylvania area. Yeah.
Wow, so, that's amazing.
Yeah. So I think but those examples are few and far between, I think. So
I would agree with you. I think, as someone who came from the quality world, it's often, you're trying to just maintain quality, and make sure patient satisfaction stays, decent and get reimbursed, right? And trying to be innovative and improve, that's like secondary if you have patient, patients getting harmed and those kinds of things. How much do you think that, well, we know that COVID, of course, has impacted everything, but and we've seen some innovation was around telehealth. I mean, a telehealth adoption was like 10,000% or some crazy number. What other types of innovations do you think COVID can help us, or what other things can COVID help us think about? Because people have had to be innovative every day when they come into the, to the ER, right? You can't do things the same, or people had to sew masks. Are there any other thoughts or nuggets that you think COVID has given us to around innovation or improvement, doing things differently?
Oh, one of my mentors, Paul Batalden, who was at Dartmouth for years and has now retired back to Minnesota. He told me as I was coming into this role last spring, he's sort of a mentor and coach for me, and he talked about, don't let a good crisis go to waste. Go ahead and change what you want to change. Just go ahead and move forward with all these plans you have. Just blame it on the virus. It's a very nasty virus. Just go ahead and do that. And I think to some extent, Rich, that's true. I think that at AUPHA, we've definitely been able to move forward and engage more with the membership outside of the two previous big face-to-face meetings that we had in March and in June. I mean, we're offering webinars every month. We're gathering more resources. We doubled the activity on our AUPHA network, our online community. We've gathered, I think, over 24 really high quality cases that faculty can use in teaching. So I do think that the virus has and the pandemic has spurred us on in that way. The same way, I think the same can be said about healthcare delivery with regard to quick responses, being more flexible in terms of where you provide care, having to change the way you utilize units or space in a healthcare organization, depending on what patient surge, patient volume looks like. I think the same thing is true with regard to policy, which can be the toughest nut to crack. I think many times policy and related reimbursement issues really hold back healthcare organizations from making as much progress as they could make in a timely way. And telehealth is a great example of that. So before the pandemic, there were so many rules and regulations, restrictions around very small reimbursement rates with regard to telehealth, what you could do in state versus what you could do out of state for organizations that have patients all over the country, like Mayo and Cleveland Clinic and Emory and Duke and others, all the big academic medical centers and big health systems. And we got past that, and we got past that very quickly because we had to. We had to respond to the needs of patients. So I think that if we had that more, let's adapt, let's be nimble, let's do it more quickly, we would be more responsive to the needs of patients and the needs of communities. And maybe we would be able to more quickly get some of the inefficiencies out of the system as well, because that is key. Medicare, Medicaid, private insurers are not going to pay us more for what we do. I mean, that's really clear. They're either going to keep ratcheting down on what we're paid, or it's going to be stable. There's not going to be any more reimbursement. And so we've got to figure out better ways to deliver care. We've got to figure out better ways to package the financing and the delivery of care, and that relates to risk, which healthcare organizations haven't been very good at. Mostly the insurance companies have been very good at thinking about and then acting on that. And we've got to think more about community health and population health and keeping people healthier.
Right.
So,
right.
Yeah.
Those are great thoughts. Well, let me ask you this as we get toward the close here. Any guidance or thoughts that you give executives? I mean, you're obviously the leader of the organization that is concerned with, healthcare, graduate and undergraduate education. What would you tell an executive? Hey, that about a new accession or an intern that comes in with all these great ideas and wants to change the world. They walk into the doors and they hit this wall of culture. It doesn't allow them to bring their great ideas to the table. What would you say to those people or that C-suite? Here's what you need to think about, or how what say you?
Well, I have this opportunity. I've actually been involved now for 3 years with Centers for Medicare and Medicaid Services demonstration project with my good colleague Keith Mueller, who was my chair at Iowa, and Keith is a rural health policy expert. And Keith and colleagues and I had a project with an organization called Stratus in Minnesota with the state of Pennsylvania to help rural hospitals there move from volume to value. And I've had the opportunity, Rich, for, I guess over the last 3 years, maybe 7 or maybe as many as 9, I've been the coach for 7 hospitals, C-suite teams, CEOs, CNOs, CFOs, varying sizes of hospitals, and anywhere from 40 beds up to a couple of hundred beds. And kudos to the state of Pennsylvania and to CMMS for funding this project. And I think we've got now maybe close to 18 or 19 total hospitals that are in the project. But that's allowed me to spend a lot of time, particularly during the summer, coaching those teams and asking them to think about priorities and how to move forward and how to do things differently. I mean, I'm not sure they would do that without the resources that are there. The basis of the project is global budgeting. And so looking at the last 3 or 4 years of their productivity and their total revenue, it really assures them of no decreases in revenue if they'll move toward global budget. And then it allows them to invest in efficiency of care, more population-based approaches to healthcare, more partnering with social service and other organizations. And so that's been very cool. Now, most places you don't get that kind of structure and you don't get that kind of extra help and resources. But I think it's about prioritizing. And I think that I would say, as you're bringing in young people, whether they're undergraduate or master's interns or administrative fellows after the graduate education curriculum degree, I would say that listen first and foremost, because this is sort of like tabula rasa. These students come in not knowing they're constrained by all these bricks and mortars and by whatever the fact that you're delivering care on all the units, but quality is over here tucked away someplace by itself in a wing that nobody knows about and doesn't always get integrated into everything else that you do. Or you've got an office of patient experience that's over here in the basement someplace, and they're not, and so listen to the students and don't discount what they're saying, because they may have some ideas and some thoughts that no one else has talked about. And then also be willing to put them on the teams that I think are working on these more innovative projects. It's great experience for them. And it's going to provide, I think, a fresh perspective for those teams, some of which may be made up of people who are really good at their jobs and what they do on a day-to-day and week-to-week basis. But they've only got their eye on, the metrics for outcome with regard to what's in the dashboard right now, right? Not what's going to be in the dashboard 3 years from now or 10 years from now or anywhere in the future.
Yeah. That's a great point. The last question then is around health educators, like myself and others that are part of AUPHA and others. What do you think we can do to better prepare our students to deal with what's going on in healthcare and the future, and to maintain their zest for being fresh when they and not lose it when they walk into hospital at the wall?
Yeah, absolutely. Well, that's a great question. And that obviously directly relates to our mission. So, while AUPHA certainly wants to have an impact on the quality of education that undergraduate and master's and doctoral students get and how prepared they are to hit the ground running, we're not a student organization. We are an organization for the programs and the faculty and the staff. So we're thinking about you and all of our other several thousand colleagues around the country who direct or who serve as faculty for these kinds of programs. So first and foremost, if you're not already involved in AUPHA, get involved in AUPHA. And that would include practitioner faculty as well. We've got, Rich, in addition to the almost 300 universities that are somehow involved in AUPHA, we have a couple of hundred individual members. So even if you're someone out there who's a practitioner, you're an executive, you're in the middle of your career, mid-management position, and you want to learn to teach or to mentor or to be a better preceptor, AUPHA is the organization, similar to, if you're for your practice organization, whatever your field is within healthcare, whether it's finance and HFMA or general ACHE with regard to leadership and management. AUPHA is the organization for you if you want to teach and mentor or be an executive in residence at one of these programs. And that's related to, our new emphasis with regard to those 4 initiatives I talked about. In addition to the trends report, we are also launching an Art of Teaching Institute for the first time. Wow. So AUPHA has always been the place faculty wanted to come to learn about teaching and improve their teaching, but we haven't done it in a planned, intentional way up to this point. So we'll be rolling out a series of courses and then next courses so that people can get a certificate in teaching as well. And then side by side with that, a leadership academy, which will focus first and foremost on helping people to train to be either go into or be better at program directors' jobs, chairs jobs, and roles for practitioners like executive in residence. And both, though, the Art of Teaching Institute and the Leadership Academy will be rolled out within the next 18 months or so. We're really excited about that.
That's amazing, Dan. I'm very excited about that. I want to just thank you so much. And it was really wonderful to have you here today. I'm so excited about the direction you're taking, AUPHA, and you're really making a huge impact on all of us. And I want to invite our listeners to go to aupha.org to check out some of the great things they're doing to improve healthcare. They have an amazing mission, a great setup there, and they're really making a difference. Well, thank you so much, Dan. And I really appreciate your time. And I'll be talking to you soon, okay?
Thanks for inviting me, Rich. I really enjoyed it. And thank you, Rich, for your involvement with AUPHA and your service to AUPHA as well.
My pleasure, Dan. Thank you.